cases is always thinking about how do we look after these cases in practice, how do we manage these cats, and what information can really help to guide us in terms of treatment. So tonight, I'm going to take you through how we will manage cats with heart disease. The difficulty is, I think we have to remember that cats are not small dogs, despite some of these cats loving to act a little bit like dogs, fetching sticks, wearing Dalmatian outfits. Actually, we know that cats present with very different type of heart disease, and we probably have to think of them as a separate species when we consider heart disease and how we might manage that both in the asymptomatic or preclinical phase, and then also in the symptomatic or clinical phase of the disease. So we are planning tonight to cover the main categories and classification of feline cardiomyopathy, looking at how we might diagnose and manage preclinical hypertrophic cardiomyopathy, which represents the largest group of cardiomyopathy that we see in cats. We'll talk about managing congestive heart failure, so clinical heart disease, and aortic thromboembolism. And then after that, we will then kind of spend a little bit of time of looking at, well, where are we going? What's next in the world of feline cardiomyopathy, and what's next for our patients in terms of treatment and management? So to start with, I think the big thing about cats, as we said, they aren't small dogs. They are very different in how they present. So one of the kind of the key things when we think about heart disease is cats with heart disease, whether it's be left or right-sided heart disease, are prone to developing pleural effusion. And in dogs, we typically think of that as a right-sided heart failure when we see pleural effusion. But due to the plumbing and the mechanics of the pulmonary veins and their viscosity, their wall permeability, we will see pleural effusions with left-sided heart disease. Importantly, a murmur can be present in cats when there is heart disease, and a murmur can be present in cats without heart disease. And in fact, around about up to almost 50% of cats that present with a murmur do not have underlying heart disease, and that in itself represents a challenge. We have a cat presented to us for vaccination with a heart murmur. Is this a cat that has heart disease or not? The presence of purely just a murmur doesn't completely help us to decide on that. We might need to look for other things. Is there an arrhythmia? Is there a gallop? Are there any clinical signs of significant heart disease? Is there a history of intermittent or transient lameness? Really looking at the clues that might piece together to help us to see whether a murmur is significant. Generally, with cardiomyopathies, murmurs are lower grades, sort of up to grade 4 may be reasonable with some forms of cardiomyopathy, but really loud murmurs, grade 5 or grade 6 murmurs, so the murmurs that you can appreciate as you put your hands on the patient and you can feel a thrill, those are more commonly associated with congenital heart disease. And we won't be covering congenital heart disease today. We'll be focusing on cardiomyopathy. When we think about sort of the questions that we ask clients, how is your patient, how's your animal exercising? Now that's a challenge in itself as well. You know, cats generally will spend the vast majority of the day asleep. Trying to decide whether a cat has exercise intolerance is a challenge. And often they won't show clinical signs of heart failure until they are in heart failure. So we don't sort of get a nice warning like we might do sometimes with dogs. Finally, when we think about heart disease and we think about lung sounds, because cats develop both pleural effusions and pulmonary edema, we may hear patients that don't have crackles but have significant respiratory disease but could still have heart disease. And crackles and sort of the lower airway noises, I guess we're really sort of moving away from calling that a sign of congestive heart failure. And I think we really should be focusing on, do these cats have clinical signs of dyspnea and tachypnea as being the top priorities for making that suspicion of heart disease. So recently, in the last 5 years, there's been a sort of a reclassification. Most of it's very similar to what we have already described, but